Good morning, good afternoon, good night, doctors from all over the world. My name is Julio Reinafarge. I'm here with DHB Talks. Today we have a very special edition. The last time we've been together was last week from Miami, Florida, where we were acting and I have a little chat with doctors from many different from the United States and talking about DHB and the Universal School of Health. So this week we are gonna begin with I have a very special guest, Dr. Prashant Bhasin, who is coming from India, and he is gonna talk to us about many interesting things and about his course at the DHB that we are gonna begin very soon. So we are very happy to have him with us, and it's an honor for us also to have these kind of professors working with us at the University of Health. Um, I'm very happy. Dr. Bhasin, thank you very much for being with us this morning, afternoon, because you are late at night, I know. And thank you. And Doctor, please tell us a little bit, how do you begin in your journey for this kind of healthcare career that you are making? How do you choose to be
Well,
a
I will say good morning, good afternoon, and good evening to all our friends. It's as a part of the Doctorate in Healthcare Business (DHB) program, and I would like to extend my gratitude to Global Summit, to our friend and our brother Kenor Shah, our dean Dr. Emily, and our associate dean who is right in front of me, Dr. Julio. It's a what I should say that I started my journey way back in probably 1996 when I passed out from a schooling, and then I was looking at being from a medical background. It always fascinated me to be at a place where exactly I can serve the mankind. So I started my journey from there, and I was always looking forward to learn more, to teach more, and I always say that it's always better to be a student more, so that you can learn more and you can deliver more. And with passage of time, we started our journey, and from there, and we kept on, and that's what I like. That being an endodontist by profession, and also now into the industry from last almost 20 years, and doing mostly on the endodontic procedures and probably on the microsurgical endodontics and micro aesthetics. That's what my forte is. And being a part of the DHB program and also the Global Summit, it has given me the mission and the vision, I will say, so that we can all together as a team can work at a one point, that we should grow together and we should believe in each other and we should do something for the healthcare.
Okay, wonderful. So the idea is to bring the idea of this PhD is totally different than than the ones that we usually get in healthcare in the healthcare industry. So the idea of this PhD is to work with knowledge of how to make a business and how doctors can get connected within each other. So this is wonderful. But your team is very important because the team you're gonna talk about is about the doctor to doctor relationship and your doctor to patient relationship. Both of them are very important. So I think that it's in your point of view, you could tell us a little bit about that. How do you choose this kind of theme to um, to do it as a course? How do you choose it? You're on mute.
The topic for today was like practice management and what is more important. Being a dentist and being an endodontist, I have been into the industry, and when I was asked about the course at the DHB, I realized that one thing which is very important in 21st century, or probably every time, that we need to have a good. What is more important? It is the practice management what we are looking at, or it is the patient management what we are looking at, and that's what my course will be talking about. That I'll be talking about how we can earn our patients and own our patients. How what are the different ways that we can have a good practice management, and we make sure that our patients believe in us. And definitely we should know what are the different prognoses that we should keep in our mind when we are deciding about the treatment plan for the patient. And last but not the least, what are the outcomes of the treatment that we should be able to render to our patients so that we can give the best treatment plan to them. So I have divided my presentation into different zones so that, and it will be an overview about the course that of what I'll be doing at the DHB altogether. So it will be like a course module which we'll be doing. In every module, we'll have some or the other topics to discuss, which I will be sharing with you in my presentation very shortly.
Okay, wonderful, wonderful. That is the idea. And so we have a very strong force coming from India, because you, Dr. Pitender Singh, also he was already with his dad and right here in DHB Talks, and this is wonderful to have this kind of high-end professionals that we're having right now in in our DHB. I'm very honored with that. So, Dr. Prashant, please, yeah, I'll be very happy to hear about your presentation. You have the
Thank you.
right now.
Okay. Thank you so much. So let me just share my screen. Okay. So once again, very warm welcome to one and all. And again, I will say it's a pleasure and honor for me, and I'm actually delighted to be here to be interviewed by our Associate Dean, Dr. Julio, on this important topic. And this is my course, you can say the topic, which talks about treatment planning, case acceptance, and that is what we are looking at the Global Summit. So this is our you can say our school, the Universal School of Health, where we all are working together as a team, in which we will be like it's a team of 15 people who will be working together, and they will make sure that we should come up with a course which is a doctorate in healthcare business, which will help each and every individual who is with us to understand that how a doctor can be a best person into healthcare business. So that is what we'll be looking at. And this is our overall faculty, where you can see that we have Dr. Kenod Shah, who is the brain behind and the man behind. Dr. Emily, who is the dean of our institute. Dr. Julio, the vice dean, and the rest of the faculty from different parts of the world. We have joined hands together so that we can learn together, we can share together, and we can work together. Because we believe that a good team can achieve great dreams, and that's what we are looking at the DHB. So this is my profile, and where I am basically from India, and I did my post graduation in Department of Conservative Dentistry and Endodontics at Rajiv Gandhi University, and I am actually working as a professor and head of the department in the Conservative Dentistry and Endodontics at Sudha Rustagi College of Dental Sciences in India. And I had a pleasure to travel across the globe to various countries to deliver many national and international forums. So there are not many things which is there, but yes, these are there on our website. So I will move further from here, and I will come to my topic. That is very important, which I would like to share with you all. Treatment planning and case acceptance. So what exactly we are looking at? How to earn and own your patients. And I think that's the main area, and that's my topic, and that's my DHB course, where I'll be talking about of how to earn and own your patients. So what is our big idea altogether when we are into our dental routine practices, or when we are at our institutions, or we are at a teamwork? So one few theories associated with it is that patients set of expectations from the dentist. That's what I'll be talking about. So there are other two beliefs that it depends on the confidence that the patient has in their dentist. So the main thing is how we need to manage our practices, and for that, this is a big idea that we need to keep in our mind so that we can make our practices much more predictable and much more patient acquisition, which is there. So if you talk about the industry look, this is on the broad spectrum. If you talk about, then average population who visits the dentist is about 64.4%, and that is about almost many. You can say a lot of money you can spend on the healthcare business, and an average profit what we do goes around is around 40 to 60%. But what we are lacking is the average annual revenue per doctor. That's very important. So, but the market growth per year, what exactly we are looking now is about 3%. But yes, as we all know that the COVID has definitely affected all of us. So again, the industry outlook has changed, and that's what we are now changing to a different outlook. So if we talk about as a dentist, then I think the 45% of our cases that we all are doing are the general dentistry, isn't it? And at my course, I'll be talking about like how in those 45% of your cases, you can actually, you are able to achieve 100% success. If you talk about 45% out of the 100% is the general cases, then 38% is about the cosmetic procedures, about 22% is the pediatrics, 10% is the orthodontics, and 8% is the emergency. But yes, mark my words, from 45%, if you are able to maintain this 8% along with it, the emergency, I think you are the best person to deal with. Because that is what is your need of the hour, that you need to be present for your patients so that you can take a better decisions for them and a better treatment planning for them. So in my course, you will have key dimensions that I'll be working on with you all will be to start from the competency that a dentist should have, the compassion in the dentist that we are looking at, a confidentiality that is very important for the dentist to have. So I'll be focusing on these areas in my course. How you can build up the reliability index with the patient, that is very important. And also the dependability, that how exactly the patients are dependent and how you can make a good team with them. And definitely what I'll be discussing in my course is about the communication skills, so that we should have a good communication skills with our patients, so that we can actually develop a good patient doctor relationship. Now, where exactly there are certain areas also as a dentist we lack, that causes about an insufficient customer service leaves patients unsatisfied. So, what are these areas which I'll be focusing is on the quality of their care that we will do in our course. The staff communication also plays a critical role. Yes, when your staff is talking to your patients, it makes a different impression on them. Our
Okay.
noise, the ambient noise at your work area, that how you can reduce that, and you should make your practice much more comfortable and also a noiseless, so that the patients are at ease and they are in a zone of comfort. The patient also, there are certain areas in which the patient don't are not able to get the things properly. That is an insufficient information. So how you can come out of that, and what are the different ways I'll be sharing with you in my course, so that you know exactly how a good information can actually lead to a good patient doctor relationship. And definitely the cleanliness of the area is very important, as we have doctors all across the globe, and we have been always looking at to many things. But the yes, the cleanliness, especially this after COVID-19, how exactly you can make those areas much more beautiful to work on, and also much more appealing, so that it works better for your patient doctor relationship.
Dr. Prashant, sorry to interrupt you because we are having a lot of noise from the back. Maybe we need to, uh, we barely hear you. And,
The microphone, give me a second.
uh, yeah, maybe if we can connect from another computer while we wait uh, a little bit. Now, it seems like if you're using headphones, maybe, hello?
I hope it's better now.
No, we still have very, the noise is very hot. This is okay. Hello?
Hello.
Hello? Hello? It seems like a bad connection because it stop and stop. I don't know why.
Still the noise is there.
Yeah, we still have noise.
Hello?
Yeah.
Is it better now?
No, not really. Seems like a button. The connection, I don't know.
Dr. Prashant, can you use some other computer by any chance?
You want me to use some another computer? Okay, I can do that. How is it now?
A little bit better, but
It's better now?
it's like a rain or something that is in the back. It's like static.
Nothing.
We got a static noise in the back.
Still, it is the noise is there.
Your, your voice sounds better right now, but still we have some static.
Anshul,
Noise is there, noise is there.
noise is there still.
Yes, yes.
We have some technical problems, so very soon we will begin again with this presentation. So we are gonna talk a little bit about the DHB while it's getting ready. So the DHB is working fine right now. We are doing some lot of efforts to um, to have a better approach to all you doctors from all around the world. The DHB right now is going to be, we're going to have more than not only the 14 doctors that are committed to do the courses in the DHB, we're going to have many important guests who will be working with us as Dr. Mr. Bill Walsh, who is one of the top coaches in business in the US. He's been elected in the top 30 for 5 years in a row, and Mr. Kid Eisler, who also he's a great coach in business and is in a small business also. So the idea that we're having with the DHB is to change many ways, in many ways, the way we are approaching to our healthcare centers and our healthcare community. So what we are doing is to bring all these powerful minds, and this we are making a lot of effort. We also have Emily Letran, the dean of the school. She is also bringing Sharon Lecter, who is one of the top lecturers in coach in the States, and many persons who are involved in this kind of development. So we have Angel Tucci, we have many people who wasn't before working a lot with with healthcare communities. So what we're being with the DHB is to know a little bit about how to reach your patients in a better way, how to have what Dr. Prashant is talking about, um, how to manage your patients in a way that is going to be better for them, because you are going to be in total command of what you need from your patient, and your patient is going to be in total touch with you every day. So this is going to be a great way, and it's going to be a different way to show people how how to manage their offices in a different way. So Dr. Prashant is going to be back in 2 or 3 minutes with his presentation, and while we are gonna talk, we have a review of what we have. We have doctors that already presented over here, with Dr. Pritender Singh, who was talking about the academic part and all the research projects that you're going to follow up in this DHB. We also have Dr. John Cryak, who is a pharma PhD, and he's working with us very closely. He's very involved in research in pharma, genetics, and he will be also be working with this kind of work in the DHB. And also we have a little talk with Dr. Bill Williams, who will help us with the platforms that we are managing in our Universal School of Health. It's a very, very novel platform and very interesting platform. It's called OnPassive, and OnPassive is going to be working with us on the Universal School of Health also. And so we have many, many initiatives that will be working with us on the Universal School of Health. We're going to work with continuing education courses. So soon you will see how we can manage many things that are linked to our dental professions. So there will be courses for doctors, for dentists, it's going to be their courses. For MDs, it's going to be their courses. For chiropractors, and many new things that we're going to have with the Universal School of Health. We have Dr. Prashant Bhasin again with us. So, doctor, it's your connection better? You're on mute.
Okay. Sorry for the inconvenience. I hope it's better now.
Yeah, it's much better.
Thank you so much.
Okay. So please continue with your presentation.
Yeah, just 1 second, I'll do that. Zoom to the one.
Wonderful. This part of this presentation is very important for us because it means a lot for the doctor-to-doctor movement. So what Dr. Prashant is showing us is a little bit of this. And the treatment planning and the case acceptance is very important for each and for every doctor around the world. So please, Dr. Prashant.
Okay. So I hope my presentation is clear now.
Yeah, that's good.
Okay, I'll just move a little further from where we were.
Dr. Prashant, I think we can start from the beginning because earlier there was some noise.
Okay, good to go, no problem. Okay, thank you. Well, again, a very good morning to all of you, and sorry for that a little glitch in the network connection. So we are back again with the bang, and as we all know that I'm here to share my views and experiences that what we'll be covering in our DHB course that will be on the treatment planning and the case acceptance. So as this is our the website, that is the universalschoolofhealth.com, where everybody can join in, and you will have a much more details of what exactly the program we are doing. It's a team of 15 healthcare professionals who have joined hands together and who are working to the one goal that let's learn and share together, and especially towards the healthcare business. And this is our overall faculty, and it has been the brainchild of our dear friend, that is Dr. Kianor Shah, our Dean Dr. Emily Letan, and our Associate Dean Dr. Julio, who is there in interviewing me, and rest the team of 15 well-known, you can say, professional across the globe, and that is what we are looking at. That we should join together hands so that we can give the best to our healthcare providers. And this is a little bit of my profile which is there, and for that I think we can go on to the DHB website, where all the details of all the health faculty who is a part of the DHB program is being given there. So those details are available. And let's go to the course. That is what exactly I am here to share my views and experiences on the topic, that is treatment planning and case acceptance. What we all know today is that we are looking at 21st century is how to earn and own your patients. So there are two different terminologies. Number one is to earn and number one is to own. So I think these two words make a lot of difference. And during my course, I'll be focusing on the different perspectives, how we can earn and own our patients. So what is the big idea in my course that I'll be talking about? As we all know that the few theories are associated with the patient's set of expectations from their dentist, and there are others who believe that it depends on the confidence that patients have in their dentist. So I'll be talking more on these two major perspectives so that we have the overall idea during our like you can say case acceptance and the treatment planning, and how we can build up a confidence in our patients. So if we talk about the industry outlook, right? So we always work into a market, right? Now, if we see here, this is a journal overview that we have seen, that about average population who visits their dentist regularly is around 64%. And how much funding or how much you can say the involved in this is a healthcare spending is about 124 billions. But the average profit margin is around 40 to 60%. But the average annual revenue per doctor is always a question mark, and the market growth per year is about 3%. Now, what we are looking at altogether is that we are looking at majorly about how we can extract from this market the best for our patients. That is what we are looking at. And in my course, I'll be talking about how we can do that, how we can acquire more patients, how we can have a case acceptance, how we can build up a confidence of our patients on us. So this is the general treatment plans that generally the patient comes to us, right? Starting from the journal, that rules about 45%. Coming to the cosmetic procedures, that talks about 38% of the market. Then we have an orthodontics, which talks about takes about 10% of the market. Pediatrics takes about 22% of the market, and definitely 8% is the emergency. And I always believe that this 8%, there is a very good saying that you take care of your penny and the pound takes care of itself. The main thing is that we need to take care of the emergencies. And if you're available on that day, I think you are the first and you are the god for your patients. And that's what I believe, and that's what I practice in my practice. That is what exactly I'm looking at. So we need to focus on our area of practices so that we can develop a good patient acquisition and a good patient doctor relationship. So in my course, I'll be talking about the key dimensions that you'll be working on, starting from the competency of the doctor-patient relationship, the compassion of a doctor with the patients, the confidentiality which he'll be sharing with his patients, the reliability index, how you can actually develop with your patient and doctors, the dependability, and last but not the least, the communication skills that you will develop in our course so that you can acquire more patients and also you can build up a good bond with your patients. Now, I will be also sharing my views, and I'll be talking about in my course about why so many patients you lose in your practices. And that is what is under the main heading I'll be focusing on, the insufficient customer service leaves patient unsatisfied, in which I'll be talking about how you can give a good quality to their care, how you can train your staff to have a good communication skills. If there is an ambient noises at your practice area, then how you can reduce that. That means how you can make your practice much more comfortable and much more calm and composed, because when we are talking in dentistry especially, we need a calm atmosphere. We need something with which we can actually deliver a good you can say a good health care to the patients. definitely insufficient information, how you can come out of those areas so that you can provide good information to your patients so that they can have a better trust developing in you. And last but not the least, how you can maintain those cleanliness in your areas, talking about those sterilization and disinfection protocols. And especially after COVID-19, I think some things have become much more clearer because we have our friends and colleagues all around the globe, and that is one area which we will be focusing more on. Now, another things which I'll be focusing on my course during the DHB will be how you communicate effectively with your patients, how you can educate your patients about the treatment plan. The most important area which I'll be focusing is on the manage your patient's pains. That is, I think, is the area which I'll be focusing more on so that you can actually know that how you can relieve those pains and get better patient-doctor relationship. I'll be focusing on the patient's waiting time. That is, I think, which I have seen in my practice in last 20 years, that the patient's waiting time also makes a lot of differences. That how you can reduce the patient waiting time and how you can give an effective time to your patients to do your job. And last but not the least, in the focus, we'll be focusing on how we can build the patient's trust. So, because I think that is one of the key areas that we look at as a professional, that a trust is a building block, not for one patient, but for families. That is what I believe. Because I believe that once a patient reaches to your dental practice, it is not only the one patient you are treating, you are actually building a relationship for life. So another important area which I'll be focusing on in my course will be a systematic approach and a treatment planning. So if we talk about a systematic approach, this is very important we need to understand. We need to learn the difference between treatment planning and treatment sequencing. Now, this is the area which I'll be focusing in my DHB course so that you can, because most of the time where we fail at that, we make a treatment plan, but we are not able to sequence it. Sometimes what happens, you say, okay, this area I'll do first or this area I'll do later. But yes, please remember, if you are not clear in your treatment planning, then how you are going to execute it. So planning and sequencing, how you can do that depending upon the case, that I will help you to do in my DHB course. Again, I will make you understand the concept of treatment planning and the aesthetics and about the function, structure, and biology in the planning process. That how exactly you can get all these things in place so that once you are planning a treatment for your patients, you keep all these plays into the systematic approach and give a better treatment planning to your patients. In my course, I'll be also be discussing about the risk, the prognosis, and treatment outcomes, how you can make them much more predictable. Now, whenever in the risk, we will talk about in our course will on the evidence-based decision making that I'll be focusing about the heritable conditions that is being there that we need to look into it. That is very important. Some of the systemic diseases as a risk indicator for oral or general health problems, that how what are the different questions you will going to ask your patients and how you can actually have a script of those questions with the patient. You can question them and they can answer you back so that we can have a good patient doctor relationship. Also about the function and the trauma related conditions, about you need to discuss about with your patients to know about that what are the risk prognosis and the treatment outcomes are involved. And last but not the least, if there is any previous disease experience, if that is there, that will also help us to understand about the risk prognosis and the treatment outcomes. Because once we have these 5 parameters in our mind, we can interact better with our patients and we can get a better treatment plan for our patients with a good reliability index, and along with good communication skills will help us to make the treatment outcome much more predictable. If we talk about the prognosis, again, I'll be talking about the prognosis, how exactly, because it will be a case-based approach, which I'll be talking in my DHB program, where we have different types of cases related to the different treatment modalities, starting from the endo and other specialties as well. So all the 9 specialties we'll try to cover in that, so that from the diagnosis to the treatment planning, when you are start discussing with your patient, then the prognosis of the patient has to be told to the patient in a much clearer form. So the impact of your prognosis on the selection of treatment option and on the plan of care, That is the part which we'll be focusing and we'll be covering in our DHB course. Another important thing which I'll be focusing on, that is the last part in my program, which I'll be focusing is on the outcomes and the outcomes measures which is being there. So what are those? That we are using some outcome informations in treatment planning process. For example, when should a defective restoration be replaced, right? So there's always a dilemma. I should replace now, I should replace later, should I wait, or should I go for something else? When should a heavily restored tooth should be crowned? Again, these are the outcome measures that we need to discuss, and I'll be like, as I said, how exactly it happens. We should be, if there is a missing posterior tooth, how it should be replaced, probably with a bridge or an implant. Then we need to educate our patients so that we develop a good trust with our patients, and we need to understand and we need to make them learn about the pros and cons of the treatment. And I believe one thing, that be clear to your patients. The more clearer you are, the better patient doctor relationship can be built. And for example, should suppose a tooth with a failed root canal treatment, will that be requiring a retreatment? So most of the time what happens, we are in a dilemma. Okay, we can do a retreatment, we cannot do it. So again, a case-based approach will help us to decide those outcome measures, because once you are skilled and equipped both with patience and persistence, the outcome measures will be much more predictable. Now, another important area which I'll be covering in my DHB course is how you can increase the acceptance of proposed treatment plan. So what are the things I'll be focusing on? Make it a team effort. That means how we as a doctor and a patient can work together as a team to develop that. Present ideal treatment plan to everyone. Again, that is very important, which I'll be discussing more in detail in my DHB course, that what I say and what we believe, that you should, whether the patient, any patient which is coming to your practice, an ideal treatment plan should be discussed with every patient, and we must follow all the protocols. That is very important. Another key area which I'll be focusing on is script every aspect of your case. That is very important. You need to script it, so that, because once you write and give to the patient and everything, how it is to be written, what are the things that you should keep in mind when you are scripting the case presentation, so that the patient should understand the every aspect of the treatment. That is very important. And last but not the least, learn from rejection. If suppose the patient is not ready for that, then how you can, from that rejection, don't get disheartened. We have another plan to work on. I always say there are different plans to work on. Definitely we need to decide our plan and then execute it. So if suppose A is the treatment that what we have planned, then we also have a plan B. So again, for example, if we have to go for an implant or for a bridge, we need to understand the patient psychology. We'll be discussing on that, and how we can make sure that patient doctor relationship can be built on trust, and a best treatment plan can be given to your patients. So that is what exactly which I'll be covering in my course in all together throughout the DHB. It's a modular program in which I'll be covering these 4 modules at a different levels and at different stage, so that we can start discussing more on this more frequently in future. Thank you one and all.
Thank you very much, Prashant. It was a very successful presentation, I think so, because what we're talking about is to talk about planning and talking also about a multidisciplinary approach. So it's going to make us work together in different specialties and how to treat and how to reach each one of your patients. It's going to be a great course, and I think we are going to make many good things for all the doctors. And it's not also, it's going to work with dentists, it's going to work with every doctor from
Yes.
every specialty, because you know, maybe what we need to begin is between the relationship between dentists and MD doctors, and also with chiropractors, with pharma, and all the specialties that we are having in healthcare, because it's going to make a huge difference to do this kind of approach for our patients. It's going to be, this kind of relationship is going to go in behalf of our patients. So
Yeah,
I
that's
think it's going to work
yeah.
fine.
Even I believe Julio on the same, because the idea behind is the program which I have designed on a case acceptance and a treatment planning is for the whole medical and the dental community, whoever comes in. It is not only specific to one particular dentistry. We
Mhm.
are we are open for every branch, every specialty, because what I believe that the base of any success of any doctor, first thing I believe is a doctor-patient relationship, and how we should go ahead and make sure that our relationship goes for lifelong. Because we are doctors, we are not businessmen. We have a relation building up from a niche level. I think, for example, if I am a dentist and like we have a chiropractic, we have pharmacists, we have medicine. A child goes to a pediatrician, right? Is once
Mhm.
he's born. I feel the relation starts from there, and as he grows, he goes to and exposed to every other specialty during his lifetime. So this program at the DHB in case acceptance and in treatment planning will be focusing on the entire perspective of the complete treatment plan and how exactly we can make a good patient relationship with all the specialties in the field of medicine and dentistry.
Wonderful, wonderful. Because this is what is gonna make a difference between before and after our DHB. Because working together with all the specialties is gonna make a huge difference.
Yes,
Because
because
it's gonna bring the
I
patient.
believe the same. I believe the same because I am from a family which has a multidisciplinary approach. That's what I say. Because even in dentistry, we like sometimes you need a cardiologist probably to understand. Okay, there is a heart condition. Okay, on days sometimes there is a newborn child, so you will discuss with the pediatrician. Or there is a child, if there is some problem is there, we can discuss with the pediatrician. And if you are treating any kind of disease, so again it's I always say it's a teamwork. It's not only pertaining to only a dental surgeon or probably an endodontist. It is actually a team, because you are prescribing a medication to your patients again. So a good pharmacy, a pharmacist will help you to understand, okay, the kind of salts you can do that. So the
Mhm.
idea is all behind that. We are blessed that we have a good team with us at the global summit at the DHB, which is, I think it will be one of the great association which will help us to understand and also learn and share together in different branches of the medicine and dentistry altogether.
Yes, and it will also bring us with the most updated information about each one of the careers and each one of the specialties that we're gonna with to bring that for the patient. So we'll have the updated information, updated data. If we need a cardiologist, if we need a dentist, if we need the last pharma updates that we are going to bring to our patients and how to treat them better. So it's going to be on behalf of the patient. And that is great. That's the idea of this THB also. Thank you very
Yes.
much.
Thank you so much. And again, thanks to all the delegates, and thanks Julio, our associate dean. Thanks to our friend Kenod Shah and all the team Global Summit, DHB. We are all as a team, DHB, I will say, will invite all our delegates to join us, and we will be looking forward. All the details are available at the DHB website. And again, I say, let's come together, learn, share, and make a team. Thank you, one and all.
Thank you very much. Thank you very much. Doctors, thank you very much for your time, and we are very very happy. We're gonna have a couple of more webinars today. Very interesting, interesting issues. We wait for you. Don't forget, if you want your CE credits, you can post it. You have all the information in the comments in the Facebook. Thank you very much, and have a nice weekend.
Thank you.